Leaky gut, the invisible enemy destroying your health from within. Leaky gut syndrome, also known as increased intestinal permeability, is a condition characterized by the impairment of the intestinal barrier. The intestinal barrier, consisting of a single layer of cells lining the intestine, plays a crucial role in selectively allowing nutrients to be absorbed while preventing harmful substances from entering the bloodstream. In this comprehensive article, we will explore the causes, symptoms, diagnosis, and various healing approaches for leaky gut syndrome. Part 1: Causes of leaky gut syndrome. Imbalance in gut microbiota. Disruption of the balance of beneficial and harmful bacteria in the gut can contribute to intestinal permeability. Chronic inflammation. Conditions such as Crohn's disease, celiac disease, and irritable bowel syndrome, IBS, can cause chronic inflammation in the gut, leading to increased intestinal permeability. Food sensitivities. Certain foods, such as gluten, dairy, and processed foods, may trigger an immune response and inflammation in the gut, contributing to leaky gut syndrome. Medications. Prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, antibiotics, and proton pump inhibitors, PPIs, can disrupt the gut microbiota and affect intestinal barrier function. Stress and lifestyle factors. Chronic stress, inadequate sleep, excessive alcohol consumption, and smoking can weaken the intestinal barrier and contribute to leaky gut syndrome. Part 2: Symptoms of leaky gut syndrome. Digestive symptoms. Abdominal pain, bloating, gas, diarrhea, and constipation may be present. Food intolerances. Increased sensitivity to certain foods, with symptoms like headaches, fatigue, joint pain, and skin rashes after consumption. Nutritional deficiencies. Malabsorption of nutrients can lead to deficiencies in vitamins, minerals, and other essential nutrients. Immune system dysfunction. Leaky gut syndrome can trigger an overactive immune response, leading to allergies, asthma, autoimmune diseases, and frequent infections. Systemic symptoms. Fatigue, brain fog, mood disorders, joint pain, and skin issues may occur due to the release of inflammatory substances into the bloodstream. Part 3: Diagnosis of leaky gut syndrome. Clinical evaluation. Healthcare providers assess medical history, symptoms, and potential risk factors to determine the likelihood of leaky gut syndrome. Intestinal permeability tests. Various laboratory tests, such as the lactulose mannitol test or the zonulin test, can measure the permeability of the gut lining and provide insights into the condition. Stool analysis. Assessing the presence of specific markers and imbalances in the gut microbiota can help diagnose underlying factors contributing to leaky gut syndrome. Part 4: Healing approaches for leaky gut syndrome. Dietary modifications. Elimination or reduction of trigger foods, such as gluten, dairy, processed foods, and sugar, while emphasizing whole, unprocessed foods can help heal the gut. Nutritional supplements. Nutrients like glutamine, probiotics, digestive enzymes, omega-3 fatty acids, and vitamins A, C, and E can support gut healing and reduce inflammation. Stress management. Implementing stress reduction techniques such as mindfulness, meditation, yoga, and adequate sleep can positively impact gut health. Gut microbiota restoration. Probiotics, prebiotics, and fermented foods can promote a healthy balance of gut bacteria. Addressing underlying conditions. Treating underlying conditions such as IBS, celiac disease, or autoimmune disorders can help manage leaky gut syndrome. Intestinal barrier dysfunction. Leaky gut syndrome occurs when the intestinal barrier becomes compromised, allowing undigested food particles, toxins, and bacteria to leak into the bloodstream. This triggers an immune response and systemic inflammation throughout the body. Effects on immune function. The intestinal barrier plays a crucial role in immune function. When it becomes permeable, it can lead to an overactive immune response, contributing to allergies, autoimmune diseases, and chronic inflammation. Connection to autoimmune diseases. Leaky gut syndrome has been associated with several autoimmune diseases, including rheumatoid arthritis, Hashimoto's thyroiditis, type 1 diabetes, and inflammatory bowel disease, IBD. It is believed that the leakage of undigested food particles and toxins triggers an autoimmune response. Impact on mental health. Emerging research suggests a link between leaky gut syndrome and mental health conditions such as anxiety, depression, and even neurodegenerative disorders like Alzheimer's disease. The gut-brain axis, the bidirectional communication between the gut and the brain, plays a significant role in this connection. Environmental factors. Environmental toxins, such as heavy metals, pesticides, and pollutants, can contribute to leaky gut syndrome by damaging the intestinal lining and increasing permeability. These toxins can be ingested through contaminated food and water or inhaled from the environment. Chronic stress. Prolonged stress can negatively affect gut health and contribute to leaky gut syndrome. Stress hormones like cortisol can impair the integrity of the intestinal barrier and disrupt the balance of gut bacteria. Diagnostic challenges. Diagnosing leaky gut syndrome can be challenging, as it does not have a specific diagnostic test. The symptoms of leaky gut syndrome can overlap with other digestive disorders, making it important to rule out other potential causes before making a diagnosis. Individual variations. Each person's experience with leaky gut syndrome can vary. Some individuals may be more susceptible to developing the condition due to genetic predispositions or underlying health conditions. Factors such as diet, lifestyle, and gut microbiota composition can also influence the severity and progression of the syndrome. Holistic approach to healing. Healing leaky gut syndrome often requires a comprehensive approach. Along with dietary and lifestyle changes, managing stress, optimizing sleep, regular physical activity, and addressing any underlying conditions are crucial for supporting gut healing and overall well-being. Professional guidance. While there is growing awareness of leaky gut syndrome, it is essential to consult with healthcare professionals, such as gastroenterologists, functional medicine practitioners, or registered dietitians, who specialize in gut health. They can provide individualized guidance, conduct appropriate testing, and create tailored treatment plans based on the specific needs of each individual. It is important to note that the concept of leaky gut syndrome is still evolving, and more research is needed to fully understand its mechanisms and implications. Consultation with qualified healthcare professionals is always recommended for accurate diagnosis and personalized treatment.